Hello friends, welcome to my channel Doctor Online 24/7. Today, I'm going to tell you about thalassemia. Thalassemia is an inherited blood disorder in which the body makes an abnormal form of hemoglobin. Hemoglobin is the protein molecule in red blood cells that carries oxygen. The disorder results in excessive destruction of red blood cells, which leads to anemia. Anemia is a condition in which your body doesn't have enough normal, healthy red blood cells. Thalassemia is inherited, meaning that at least one of your parents must be a carrier of the disorder. It's caused by either a genetic mutation or a deletion of certain key gene fragments. Symptoms of thalassemia. The symptoms of thalassemia can vary. Some of the most common ones include bone deformities, especially in the face, dark urine, delayed growth and development, excessive tiredness and fatigue, yellow or pale skin. Not everyone has visible symptoms of thalassemia. Signs of the disorder also tend to show up later in childhood or adolescence. Causes of thalassemia. Thalassemia occurs when there's an abnormality or mutation in one of the genes involved in hemoglobin production. You inherit this genetic abnormality from your parents. If only one of your parents is a carrier for thalassemia, you may develop a form of the disease known as thalassemia minor. If this occurs, you probably won't have symptoms, but you'll be a carrier. Some people with thalassemia minor do develop minor symptoms. If both of your parents are carriers of thalassemia, you have a greater chance of inheriting a more serious form of the disease. Different types of thalassemia. There are 3 main types of thalassemia, and 4 subtypes. Beta thalassemia, which includes the subtypes major and intermedia. Alpha thalassemia, which include the subtypes hemoglobin H and hydrops. Thalassemia minor. Diagnosis thalassemia. If your doctor is trying to diagnose thalassemia, they'll likely take a blood sample. They'll send this sample to a lab to be tested for anemia and abnormal hemoglobin. A lab technician will also look at the blood under a microscope to see if the red blood cells are oddly shaped. Abnormally shaped red blood cells are a sign of thalassemia. The lab technician may also perform a test known as hemoglobin electrophoresis. This test separates out the different molecules in the red blood cells, allowing them to identify the abnormal type. Treatment options for thalassemia. The treatment for thalassemia depends on the type and severity of disease involved. Your doctor will give you a course of treatment that will work best for your particular case. Some of the treatments include blood transfusions, bone marrow transplant, medications and supplements, possible surgery to remove the spleen or gallbladder. Homeopathy addresses the root cause and offers medication which are help eventually reduce the need for frequent blood transfusion. Homeopathic medicines also help to improve immune status, which in turn also controls frequent attacks of respiratory infections. This is all about thalassemia. Hope this video is beneficial for you. Thanks for watching. Doctor Online 24/7 by Dr. Sana Bawani.